teeth.
Welcome back. I'm joined in the studio with Dr. Larry Benj and Dr. Malo, and we're answering some frequently asked questions about the Malo All-on-4 protocol. Thank you guys for joining us today. So starting off, Malo, would you do an extraction of teeth and immediately place the dental implants in one procedure?
Absolutely. That is normal procedure. A lot of people they have teeth that are not, we can't save them, either because they are moving or they're just roots. So we normally remove the teeth, clean the infection, and place the implants immediately. And the teeth immediately.
And I've got to say, when I first saw that in 2007, I went, ooh, they're like this. And many dentists today just don't realise that that's what you can do, because what they then ask the question is, I'm putting the implant into a hole. But the procedure is that when we actually clean the bone, we actually change the level of the bone. So the holes where the teeth came out, basically, 50% of them disappear. So it's actually a really change in the concept of the way that Malo taught the procedure.
Larry, what type of ballpark figure would I be looking at to pay for the procedure, and is there any follow-up or out-of-pocket fees required?
Cost is obviously very variable, and it's going to depend on what the procedure you're having, whether it's a simple standard all-on-4 in the lower jaw, whether it's going to be a standard case in the upper jaw, or more complex, more difficult. What we like to do is divide them into really easy cases, medium cases, difficult cases, or then when we get into the quad zygomas, the zygoma cases, the cost varies. So you may start at $17,000, and work up to $30,000 for a jaw, depending on there. So I always say to people, it's very hard to give you an exact cost until you come in, we have a look at your radiograph, and we determine what sort of case you are.
Paolo, how long would I be looking to be off work for?
Well, again, it depends on the complexity of the case. If it's a simple case, you should not be off work. You can do it on one day, and the next day you can work. If it is a complex case, you can be off work for 2 or 3 days. It actually only depends on the complexity of the case.
Larry, I speak a lot in my job. I didn't write this question. Would my speech be affected for a while? If so, how long?
There can be an adaptation process, definitely. I remember vividly when patients go having their own teeth to go to a denture and the roof of their mouth is covered, they had tremendous difficulty in speaking, and all patients were experiencing that. When you go back the other way, back to having the roof of your mouth free, most patients think this is fantastic, but it's related to where the position, I think Paolo would agree, the position of the teeth is. So often we're moving the position of the teeth to enhance the look of the face. So there can be an adaptation process that the tongue goes through, because they've adapted to one procedure, now we're moving to something else. So I always say to people, don't be in too much of a hurry. There will be speech changes, but you'll get used to it.
And it's important also to say that the treatment of the dentillus, it's not easy. This is a complex treatment, and sometimes we do need a speech therapist, especially if the patient has a complex case where we have to place a lot of material to substitute the bone that was lost, like the prosthesis, the bridge, or the teeth, if you will. If the bigger the bridge, the bulkier the teeth, the more speech problems the patient will have in the next days. And some, especially the elderly, they have sometimes to go through speech therapy to be able to get back to their normal speech.
Larry, will I have any bruising or swelling after the surgery?
Yeah, but if you have surgery, you can't do surgery without having swelling, and you can't do surgery without having some bruising. So if your expectation is you're not going to have that, then it's unrealistic. I always say to patients that you'll swell after the operation, get to a maximum, usually it's 72 hours, and that'll start to subside. Bruising's quite variable. There'll be people that bruise a lot, and you may be on things, remember we discussed about our medical condition, if you've been on blood thinners and you might be taking fish oil tablets or a whole multitude of things which we know we need to establish before the surgery. So sometimes I get patients that go through the procedure and have no bruising. Other times I'll have patients have bruising and they might have bruising for a week to 10 days. But one thing's for sure, swelling goes down after an operation and bruising goes away.
I have a tricky overbite, a crossbite. Would that present a problem when developing the bridge for my teeth?
No. You see, the thing is that when we do a complete teeth substitution, we actually allow ourselves to place the teeth where we want, and also the type of tooth that we want, and the color and the shape. Everything can be decided by us. In fact, it is very difficult for nature to compete with a set of new teeth with the Malo Clinic bridge. Very difficult to compete because we can make it as we want. The color, the size, the shape, the position. So it's actually an unfair competition with nature.
And I should add that because of the protocol is that we make a set of teeth, which is the first set of teeth, which is in the healing phase, we have the ability, if we do have speech issues, we do have aesthetic issues, we do have things that patients are concerned about, that's fine. I say, we're wearing these for the 3 months for the healing phase, then the protocol is to go on to the final teeth. So we can learn from what we've done, and the patient can learn from what they've done and say, well, I thought this is what I wanted to do, but this is actually what I want to do. So we have this ability to then tailor make it like we discussed previously, so that you're going to be very happy with your smile.
Larry, can you give me an indication of what my soft diet might be like and how long I'm on it for?
Well, it's not vitamising Big Macs or anything like that. I always say to people, you've got to avoid hard apples, hard breads, very hard carrots, really hard things. You keep to not a mush diet, but a diet that's reasonably soft, because we don't want to overload the implants. Remember, bone takes 3 months to grow onto an implant. The whole beauty about the immediate loading, the all-on-4 protocol that was developed, is that you get your teeth on day 1 or day 24 hours. So you've still got to be a little bit conscious of not pounding on those teeth. So that's why we recommend just having a little bit softer.
As a matter of fact, the problem is not so much the hard diet. The problem is people that clench their teeth. Hard diet, if you can avoid carrots, but how many people eat carrots? And probably somebody that comes to us for a full mouth procedure is not eating carrots for many years, right? But the problem is that they actually can clench. They sometimes, due to stress, they bite hard, and that is the danger part. So, and that we can't solve. So basically, we always say a soft diet, but if they buy on a little bit of a hard bread or this and that now and then, it's not really a problem. Although we don't want to say that, because then obviously people say, "Oh, doctor said it's okay."
Give people an inch, they'll take a mile.
You should definitely tell them not to break crab legs with the teeth.
Okay.
Yeah.
Now, Paolo, does one remove the bridge of teeth to clean them, or how does this work?
Bridges are like natural dentition. We call it the third dentition. The first are the milk teeth, the second is the normal dentition, the third is paid for. It's your dentition. You should never take it out. Never. If the advantage of the third dentition compared to the second natural dentition is that if there's something wrong, we can actually unscrew it, take it out, fix it, clean it, and put it back on. So that's an advantage compared to the natural dentition, which obviously we cannot take it out, fix it, and put it in the mouth. But you should never ever take it out unless something is broken or there is a strong need to do it.
And that may be that somebody comes back and they've been to an appointment and we can see they're not cleaning it, the gum gets red and irritated, but the protocol, which we keep referring back to, is we've created the teeth in such a way that it's very easy to clean. Where we see problems, and I see them coming, patients coming from Asia, not done in Palo's clinics, is that the surgery is not done in the right way, so the teeth are uncleansable. That is a disaster. The surgery has to be done in a way that the teeth are cleansable, and we adhere to that. So you come in and you have a hygiene visit, like you would look after your own teeth. You've still got to maintain these teeth. You've still got to look after it. As Paolo said, if there's an indication to take them off, and what the indications might be, if we see you're not cleaning them properly, you might say, look, oh, I'm having some pain when I bite, which would be unusual. Those sorts of things, then we would unscrew them and check that everything is okay underneath.
Well, thank you both again for today.
Thank you very much.
If you've got any questions that you've got for the boys, send them on through to us and we'll get them on down on our next frequently asked questions.
Thanks, Eva.
Thank you.